So Jo, over to you.
Thanks, Steve. Hi, I'm Jo Nicol, the Designated Doctor for Safeguarding Children at the ICB. Oh, hang on a minute, I'm just working out how to move these slides along. Hopefully you can see my first slide. Does that come up? Brilliant, yeah. So the health system is quite a complex animal, which is why it's helpful to have a conversation about how it's structured. And the ICB sits in the right-hand box, as you can see there, alongside the local authority, and together we make up the ICS. So the ICB stands for Integrated Care Board, and the ICS is Integrated Care System. So the system bit is the link between the health system and the local authority social care system. We are commissioned directly from NHS England, who are then receive their instructions from the government. So that's the sort of top-down thing. There are lots of different elements to the healthcare system. We have public health, primary care, the primary care networks, which are groups of GPs. There's the trusts, which are the hospitals. And then we have provider collaborative. So it's quite a complex system. We will share these slides with you after the presentation, so you can read them in a bit more detail. And as you can see, we've also got public health that sits in the health system, which covers things like school nurses and health visitors, who you're going to hear from later. The Integrated Care Board has is the commissioning board, really. So we take the money from the government and the NHS England, and we decide how to spend it. Some of that decision is taken for us by the government and NHS England, and then we can also decide what we need locally. So we commission services for the population of Somerset and decide how to spend that money and provide health care services for the population. And we work in partnership with the local authority voluntary services through the Integrated Care Service. So that brings together kind of larger pot of money where we share. We have responsibilities and accountabilities. So we have statutory responsibilities, particularly around safeguarding. We need to provide effective clinical professional leadership in child safeguarding. We need quality assurance. And that's provided through our contracts. We say, you know, you must provide us with those assurance. And we need to have robust and effective systems in place to make sure that we're fulfilling our statutory responsibilities to promote the welfare of children, which is outlined in the Children Act. And safeguarding is a core duty embedded in all the safeguarding systems. We commission lots of different services. This gives you a flavour of some of the things that we commission. As you can see, it's quite far and wide. And within the ICB, we have a strategic safeguarding team with, as you can see, quite a few members of the team, myself being one of them. And we are here to provide safeguarding support and advice to the health system alongside with colleagues in the safeguarding teams at the Trust. So the health system, it's helpful to think of it in terms of a kind of egg and yolk, with the patient is right in the middle of it, and then wrapping around them is things like primary care services, more specialist service. You've got your ambulance, pharmacy, dentistry, optometry, and then more widely we have community services, and then outside that are the more national issues like economic and climate issues. But the patient is very much at the centre of what we do. And then finally, I think it's helpful to think about the model of care for a health system in terms of a bit like the windscreen wiper model that we have across the SSCP, where the low-level universal services are kind of level 1, which is about supporting people with their well-being. And then as you need higher levels of support, you will have more specialist services supporting you. So what we would like to do is keep everybody at the level 1 and 2. So we give them advice and support, manage their health proactively, and then have just small numbers of people going into the higher levels, which are the more specialist, like hospital-based systems. So that's a really quick run through, and I'm going to hand over to my colleague, Dr. Mengu, who is a local GP, who's going to tell you a bit more about that side of things.
Thank you, Jo. So thank you for inviting me to this forum. I've not spoken before, and hopefully I'll just give a very useful whistle-stop tour of all things general practice. So have I opened that right? Oh, it's just come up as a mini show. Can you see it all in a big screen? Yeah, okay, fine. Right, there we go. So to begin with, what are GP surgeries? Well, most of them are small independent businesses, and these days actually lots of these are falling under umbrella organisations such as Symphony, which are wholly funded by Somerset Foundation trusts. You can work as a GP in a variety of ways. You can be a partner, so you own the business. You can be a salaried or remote GP, so you're employed by the practice. Or you can work as a locum, choosing hours that suit you. So I work as a salaried GP. The services that we're commissioned to provide are something called general medical and general surgical services, and that means we see anyone with any kind of health problem, be it dizziness, racing heart, period problems, whatever it might be. They can come in and see us. We also provide what's called additional services, so that's smears, contraceptive services with our nurses, and minor surgery. For example, at our surgeries, one of the GPs does vasectomies. And then we can opt in and do enhanced services. So at our surgeries, we do kind of fit coils and implants. We monitor people's blood thinners with blood tests, and we might do travel clinics. Lots of surgeries are keen as well on providing extra things like social prescribing for our patients, kind of tying them more into the community and demedicalising a lot of the issues that they face, as well as offering carer support. Just a few quick facts. So everybody resident in the UK is actually entitled to have a GP, and you don't need to prove your immigration status or have an NHS number or even an address. There's ways around that. However, sometimes patients might be refused. For example, if the practice list is just closed, they're not having new patients, full stop, or the surgery is outside of, or you're outside of the surgery's catchment area, or if previously the surgery's had you removed. But if so, there's really strict ways of following through on this. So it's not just done so easily. The workforce is big within general practice. We've got lots of non-clinical staff, as well as a variety of clinical people working, and each surgery is different. So some have got paramedics, GP assistants, advanced nurse practitioners, and all of them will have doctors and nurses. As Jo's already said, GP surgeries, we're obliged to all club together into PCNs, or primary care networks. This is the local one that we're a part of. And then lots and lots of other services that we have conversations with, discuss patients with, receive information from, and also provide information to. And really, what makes a good GP surgery is ideally a service that's well led, making good use of resources, and we're looking after our patients effectively, and it's a safe place to come, with good quality people doing the best for their local population. And as in common with lots of other services, it's not that much of an easy time. We could all do with more people on the ground, and healthcare is really complex, and it's a lot to do in 10 minutes. We're still, all of us out there, dealing with the fallout from COVID and the backlog, and we share that with all the other services too. We don't, we're all governed by our licensing bodies, and there's codes of practice and duties that we have to fulfil. And like Jo's already mentioned, there's standards to follow, and things like CQC will inspect us and make sure that what we're doing is safe and effective. And lastly, and I'm sorry it got removed from my original presentation, each of the slides had a golden thread running through it, and it was all going to come together on this slide. But really, everything that we do, all our interactions with patients and with colleagues, safeguarding really is at the core of what we do. So that was just making that point again. Thank you.